Mike Moore Media, the first place to hear Rockingham County news and information.
It's another Good Smiles podcast. On the media line, Dr. Norika Good. Her dental practice is on South Ayersville Road in Mayodan, and she's on the line now. Hey, Dr. Good.
Good morning.
Hey, Happy New Year.
Happy New Year, yay!
Yes, indeed. We're still celebrating. I read something the other day, Dr. Good, that says what happens in your mouth is a snapshot to your overall health. And that's your topic today, just about, isn't it?
Yes. And I think let's just kind of start off with everything is connected. I say that to my patients sometimes, and I know they're thinking that I'm crazy, but people like to compartmentalize their body, their mouth, or even things. Of course, your sinuses are just above your teeth, but people are like, what? My sinuses could, affect how my teeth feel, but everything is connected. And so, you really have to think about that when you're caring for yourself and trying to preserve the health of your body. Is, it's not just I'm doing this for this. It is, it's more of an overall take on things.
Mm-hmm. Okay. Well, it really is connected. Everything. Remember the old song about your leg bone's connected to your knee bone and your what? But everything is connected in your whole body.
Yes. There's a whole song about it. I love listening to that. Yes.
Well, you deal in dentistry and oral hygiene and all of those good things. So let's start there.
Okay. So yes, we talk about brushing and flossing, but really, and you're thinking that it's just about your teeth, but really, it's more than just about your teeth. Your mouth is the beginning of digestion, so that also should put together that whole mouth-body connection. Mm-hmm. And so, brushing and flossing does take care of your teeth, but it also helps to prevent some of the bacteria and other things from getting out of control in your mouth and therefore affecting your body. So, and I go back to brushing and flossing just because to me it is so simple to sort of take care of those things. But in addition, the other thing I want people to think about is that when we talk about the beginning of that digestion, then, good oral health, then you're able to eat better. People who, let's say if you're a edentulous, then maybe your diet isn't as great because you don't have the ability, maybe, some people do, some people don't, but maybe to chomp down on some of those healthier foods. Mm-hmm. So think about that. And then the other thing I want to talk about, just in terms of, let's just talk about the top. So the top has been, your breath also. So people think that maybe if they get a mouthwash or if they're brushing and flossing, that would take care of halitosis. However, sometimes it is an indication of something else going on in your body. It's just presenting itself in bad breath. Mm-hmm. So that's why I really want people to think about it. Your mouth it's a gateway. I mean, so like for example, going back to the halitosis, then sometimes people who have gastric reflux can sometimes present itself, or chronic gastric reflux can sometimes present itself as bad breath. And people think, if I brush and floss, I'll make it go away. But no, the problem is deeper. Mm-hmm. So, and then even in terms of brushing and flossing, though, I mentioned a minute ago about getting some of the bacteria off your teeth. The other thing is, there is a strong correlation between your oral health and your heart health. And so I think that people, you really, to do those small measures of putting your dental care at the top of your list of healthy habits, then I think that there's so much more to it that people aren't thinking about. So if you have periodontal disease, for example, or some people say gum disease, has been linked to heart disease. And so all of these things are connected. So you're doing your oral health hygiene for more than just for pretty teeth.
Oh, yeah.
It's so much more involved in that. And there are also some studies in which other systemic diseases have been maybe not linked, but sort of a hallmark of them is something is going on in your mouth. And that has led to, wait a minute, let's investigate. Let's go get lab tests, by your primary care physician to see what is going on in your blood, and having found out different things from that perspective. So, for example, sometimes people with gingival hyperplasia or other gingival issues that cannot really be explained, then sometimes we'll say, hey, why don't you go and talk to your doctor and have labs done? And sometimes those labs have revealed that there was something deeper, whether it be blood issues, or whether it be diabetes, or sometimes it is something more syndromic that really is not the norm for everybody. So it's not the first thing that comes to mind when you're diagnosing someone. However, sometimes delving in deeper after you find something in the mouth will reveal more information about what is going on with any individual. Mm-hmm. So there's a lot. I mean, I just want people to recognize that, again, just like you said, everything is connected. Everything is connected. And so in compartmentalizing health, and this is the new year, and so, again, some people are focused on exercising and eating right and those kinds of things. But, hey, flip it on its head. I mean, if you're going to do it to it. Mm-hmm. And so go all in. Sure, maybe do something different on your oral health. We talked previously about electronic toothbrushes or adding flossing to your regimen, those kinds of things. So I think if we're going all in on health because it's January. Now, hopefully this will last all year.
Yeah.
But that is one other thing to definitely consider, just because your mouth is truly a gateway to what is going on in your body.
Well, bacteria, I've heard you mention that word a lot, and that's the culprit here. Can we depend on our regular family doctor to help us with things like this, or does it come back to your office as a dentist?
No, so honestly, again, since everything is connected, your dentist can help you go in the right direction if something seems amiss. So your dentist would probably tell you start with your primary care doctor, because they would be able to then, send you to another special if that is necessary, or if they can resolve it in their office, then they can. But and sometimes it does come back that they can't find anything else, but oftentimes it does. It's one of those things where maybe you have some high blood sugar or something else is going on, and maybe a drug interaction with some other medications that you're on, and so that would be where your primary care doctor would come in play. But for the dentist, then what we would do is, if I ever find anything that I think, now that is unique, then my first step, unless it's something that I can just put my finger on and I know for sure, and let's say it needs biopsy or whatever. But if it's something that I can't quite put my finger on and is generalized in the mouth, then oftentimes I will definitely say, you know what, I think it'd be a great idea for you to go and see your primary care physician first. Start there, and then they can help figure out where do we need to go next, or is it something that they can help resolve.
Yeah, okay. Very informative, great information from you, Dr. Good, as always. Do you think people, and your program today is certainly extremely helpful in getting the word out, but do you think people are really kind of connecting the dots here with oral health and cardiovascular disease? Are you finding out people are finally putting that together?
Yes, and I love it. Yes, I think that it's been so long that everyone thought in this compartmentalized sense, but it is lately that more and more people are getting really hip to the connections And I think that is wonderful because I think that it means that we are becoming more aware of our bodies. We are becoming more aware of health, and how health is not, it's not just taking care of this, it's not just having biceps and triceps that we can show off.
Yeah.
It is really the overall kind of view of ourselves and of our health. I love it. And I even remember there was a billboard in Winston at one point talking about oral health being connected to your heart health. And I wanted to pull over and applaud because it put oral health and its connection to your general health, front stage. And I just, it really makes people think. And I thought that was wonderful. So yes, in the past, I would say 10 to 15 years, people have been paying more attention to the connections between things. So I think that's wonderful.
Oh, I do too. That's great. Well, it is the new year, and I'm thinking there may be some new listeners, Dr. Good. So let's take a couple of minutes here to tell everyone what you do at Good Smiles in Mayodan. Just kind of an overview.
Yes, so I am a general dentist in Mayodan, and we're located at 603 South Ayersville Road. And we provide family dentistry and we really want to just help you take care of your smile and help be a helpmate to improving or maintaining your oral health. And so our phone number is 336-427-8544, and we would love to have anyone, new patients, etc., to give us a call.
Well, it's always great to talk to you. Thanks for getting the new year off to a good start, as always. Thank you, Dr. Good.
Thank you. Happy New Year, everyone.
Happy New Year. All the best to you and your staff. And we'll talk again next month.
Yes, sir. Thank you.
Bye. Dr. Norika Good, I certainly appreciate her passion for her work and really caring about her patients. She does such a great job. Well, she does a good job, yes, at Good Smiles, but we can make it a great job there for sure. I certainly like the information that she shares with us on these programs every month. Let me again remind you that Good Smiles is at 603 South Ayersville Road in Mayodan, and you can find her right there online at goodsmilesdentistry.com, goodsmilesdentistry.com for Good Smiles in Mayodan. And thanks for tuning in. Please take her information and her the material that she shared with us today at heart, literally, and we'll be back with another program next month.